All right. Happy Wednesday. Welcome, everyone. I will begin with our land acknowledgement. As this is a hybrid event, we have some people online. Hi, Shaista. Some participants are on different territories, so please take the time and space to give thanks and gratitude and respect to the land that you are currently living and working on. Today, we're here at York University in Toronto. York University is situated on the traditional territory known as Takaranto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. We also acknowledge that this is the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. And as we've talked about, I feel a little uncomfortable with land acknowledgements that don't include any actual truth or reconciliation. So we spoke last time about the $30 million preliminary settlement for the Treaty 23 and 22 payout. That was for the misrepresented nature of the Treaty number 22 and the undervaluing of the land in Treaty 23, which is for the areas around Port Credit and two more tributaries just down Lakeshore that I'm sure many of us have driven past, which were sold in the 1820s with a confusion around what it actually meant, and that the land set aside for the Mississaugas of the Credit to live on was only actually held for them for 25 years before the land was surveyed and sold to settlers. And today, I think we could acknowledge another maybe component of the truth and reconciliation process, which is that the search for several missing and murdered Indigenous women in Winnipeg has finally gone forward, and two women have been found. The bodies have been found, and a third body that is being called Buffalo Woman because they have not identified who she is. She's also been found. And if those have followed this, it took years of fighting with the government to have the landfill searched, despite it being incredibly important to the communities to find the bodies and give them proper burial. So moving ahead, we will now turn to our very exciting speaker today. It's my absolute pleasure to introduce Dr. Cary Wu, an assistant professor in sociology here at York University. His research focuses on political culture, race and ethnicity, and health inequality. He has published widely on these topics and often shares his research with the public via national and international TV, radio, and newspaper forums, the exciting, including NPR, CBC, CTV, The Washington Post, Toronto Star, Maclean, and The Economist. Very cool. So maybe we can also ask you about communication of knowledge to the public. He's currently working on a 5-year SSHRC Insight Grant research project to develop a political sociology of health to study social and political trust as essential determinants of health. So welcome, Dr. Wu, over to you.
Thank you, Cary. Thank you, everyone, to join in person and online. So today I'm going to present a working paper with. Let me share my screen. A working paper that co-authored with a group of students from University of Science and Technology in Beijing. The reason I chose this project to present is also because Joanne, she's working on like a way of collecting data online, right? So in this project, we also collected over data online. So just to be consistent, that's another reason why I chose to talk about this project, like working project. So what do we know about suicide? Think a little bit, like what do you know about suicide? Suicide.
The act of ending one's life based off of like someone.
Yes, right. Suicide, yeah, can be understood as a way, an act that to kill oneself. But what kind of patterns, like facts about suicide, we know? So it's the top 10 cause of death globally, top 10, right? And if among younger population, it's top 2, just next after the accidental death. Suicide is top 2 cause of death for younger people. And then in general, a suicide is different from other type of death. It's a process. It's not like by accident people die or kill themselves, right? It's a process. People have some ideas about killing themselves, and then people also trying to attempt, right, through the process, and finally the outcome, right? Almost in people's life, like every one of us probably at some point we had the idea about thinking about killing ourselves, right? I had in some point in our life, like probably you guys are too young, but at some point we will think about this. But many people won't attempt to do that, right? So that's a very different idea about attempting, and then ideas, and finally the outcome is really like suicide, right? So there's a whole process of people take their own lives, right? So that's another, we'll come back to this process later on. And then another pattern is that globally there's more men than women in terms of suicide, right? And then of course I mentioned there's younger people, and also globally there's a huge variation. In some countries there's higher rates, in other countries there's lower rates, right? And then in terms of why, a lot of reasons, a lot of reasons. The reason can be political, right? Can be cultural, right? And of course social, and of course can be personal, right? So those. But in the context of China in 1990s, the suicide in China accounting 40% of global deaths in 1990s. But then over time, because of many reasons, right? One reason I would say is modernization, economic development, right? So overall improvement in people's life, economic well-being that lead to a huge decline in terms of suicide rate. China is also different than other countries. Most countries, there are more females in China commit suicide or kill themselves than males. In many other countries, there are more males, like I said, right? Globally, there are more males. And then also there's a huge divide in terms of rural and urban. There's higher rates in rural China. And the most common ways of means people kill themselves is through the poison. That's the most popular, especially in rural China. I would think with similar pattern in India too, when they're more rural population, especially 5, 10 years, 20 years ago, right? But over time, this is some recent data suggests that in China, there's huge decline in suicide rate, right? So for example, in early 2000, about 13 in urban and then 15 in rural per 10,000 population. But today, only about the decline. Over time, you see huge decline. Like today is about 5, 6, 4, 5, 6 per 10,000 people, right? So that's, in general, we see decline in suicide rates. But in university settings, recent years, we see a lot of case that professors and the students kill themselves, right? And then this is one science article in 2006 mentioned about like a lot of young Chinese students, they did PhD in the US, and then they went back to China to teach, to become professor. And then many of them committed suicide, right? So there's a lot of report. And if you just type in suicide in university, you will see, like, just Google lots of news talking about in university settings, in science community, that many young students and faculty members took their own life, right? And then this is the anthropologists describe this as a public secret. Why? Why is that? It's known, right? People do talk about, like, everyday life. People do talk about, like, there's suicide in Chinese universities, right? But the government and then institutions, they do not openly address this issue, right? They don't talk about it. People do talk about this, right? The media also talk about, but the government and then the political institutions and the university, academic institutions, they do not openly address this issue, right? And then because there's no, like, in terms of political and institutional, there's no leaders or like organizations come to openly address this. This is just when it happened, right? People talk about it and people forget about it. So there's lack of accountability, right? And then also there's very limited data being collected and very limited research about the growing numbers. And we don't know whether it's growing or not, right? Because we do not have official data recording the number and over time change. So for me, it also just like over the years, like I heard about a lot of news about like students and professors killed themselves in Chinese university, or Chinese professors in US or in Canada that killed themselves. I heard a lot of news cases. And then for me, just also like everyone else, right? So I know, but I don't do anything about it until it becomes personal. So last year, a friend of mine at UBC, he when I was doing my PhD, he was doing his PhD at UBC as well, and then he went back to China to become a faculty member. And last year he killed himself, right? And that become kind of personal, thinking about like if I knew so many people like kill themselves and a lot of news talking about that people kill themselves, like what we should do, like I should do, right? So then I was teaching a methods course at University of Science and Technology in Beijing with a group of students. We decided to like really collect some data, right? And there's no official statistic. Then how to collect the data? Then we decided to really think about coding all those news report about suicide among graduate students and faculty members. So that's why we started this kind of research project. And then we often think about suicide as a public issue, right? It's rather than a private, right? So this is probably like 200 years ago. The first idea about sociology is that suicide is a public issue, not a private or individual issue, right? Why is a public issue? One thing is the patterns about suicide, right? So then, for example, from the suicide, the sociologist Durkheim, when he tried to demonstrate that social forces leading to people kill themselves, he argued that there's, for example, seasonal patterns, the rural-urban patterns, the gender patterns, the age patterns, and those patterns are consistent year over year, right? Because of those data patterns, he argued that it's not all about personal decisions about killing themselves. It's social forces regulate all those patterns, right? So for example, there's a seasonal change. In certain seasons, months in each year, there's higher rates, right? And people believe in have certain religious belief are more likely to kill themselves than others, right? And people in certain areas, like rural, urban, or in some countries are more likely, right? So that those patterns demonstrate is a public issue, not just private decision, right? And when we think about this, not just the cause of suicide are coming from like weather, right? Coming from the social cohesion, right? People relationship, coming from political dynamic, all those, right? Or religious setup, right? Organizations or belief, but also the effects of suicide, right? So when one person killed him or herself, the leading to the impact or implications are also social, right? It's just not affecting the person, but also the families, the communities, and also the countries, or even the university, like other people, right? Like me, I was affected by others kill themselves. You probably, when we heard the news about people kill themselves, that will lead to certain impacts on ourselves. So that's another way to think about why suicide is also a public issue, not just a private, right? So then when we think about the public issues, causes, and also the implications or the effects. And like I said, suicide is very different from other type of death, right? For example, death by accident is very difficult to prevent, right? But then suicide is a process, right? People have ideas, people attempt, and people kill themselves. There's a process, and the process, in each of those processes, something can be done, right? So that's another way of thinking about why, when we think about developing an approach to prevent suicide is so important. In current literature, people always just building on this process, right? So they call the iceberg model, right? So identify who are more likely to have this thoughts about kill themselves, right? So the ideation, right, suicide, and who have attempted, right? So for example, the pattern is, even though I mentioned that there are more males kill themselves than females globally, but there are much higher percentage share of females attempted suicide than males. Why is that? Why there's more? So think a little bit. Why there are more females attempted, but there are more males died from suicide? Why? So in terms of attempts, there are more females, much higher share. But in terms of actual suicide, there are more males. Yes.
Is it because of the method that they choose? Like maybe the method that the females choose to attempt is not always successful?
Yes, right. So that's one key explanation is why, like, there's much higher percentage of females attempted, but then in terms of outcome, there are more males kill themselves as an outcome than females. And then one big explanation is the means, right? So for males, they're more likely to, like more fatal means, and that lead to suicide. But for females, even they have higher rate of attempting, but then they are lower. So then thinking about this, about people having this thoughts, people attempted, and people really actually killed themselves, the process. Then in current literature, a lot of people talk about this iceberg model, thinking about in each process, the cause, effects, and what we can do to prevent each of those outcomes in terms of having this idea, attempts, and then real actions, right? And then recently, there's two special issues contributing to developing this prevention strategies or public health approach, right? Really to suicide and also to preventing the suicide. They're still focusing on this iceberg model. Just to sum up, in the literature, they're talking about four things. One is to really a public health approach to preventing. They talk about four things. One is perspective, right? Highlighting, we still need to change the perspective, thinking about suicide as a public issue rather than an individual mental health struggle, right? So within the society and people, there's still people thinking about those as an individual issue, right? So that's perspective. Second is documentation, right? We really need to collect data to kind of improve the quality and timelessness and the use of those related data to developing or identify cause and effect, right? And even developing strategies. And then, of course, they need to have political will and community actions to mobilize those responses. Finally, as a research, right, need to have kind of like more investigations into the global, like leading cause of death. So for our project, the key goal is really try to outline an approach that specifically to tailor to the rising number of suicide in Chinese science community, right? So we talk a lot about there's a public health approach in general, right? But what about the rising numbers within Chinese context, within the science community? Like, what can we do? But has to be more specific in terms of what cause, right? Especially I mentioned there's a general decline in the Chinese population, but the rising number in university settings, right? So what causes, right? What are the main causes? And then whether the causes are different from certain population, right? Men, women, maybe different age in academic setting too, right? We need to know the causes and maybe the differential causes for different subgroups. So that's one thing we aim to really to know and to identify. And second is the means, like we mentioned, the means is one way of thinking about the suicide outcome, right? What are the common popular means among university settings that graduate students, faculty members that kill themselves, what the popular means. And finally is the prevention strategies. What that strategies are in place, right? We need to ask these questions and then whether they are effective or not, right? And what new strategies could be developed to preventing suicide in Chinese science community. So those are three key questions we had in mind, thinking about a public health approach to suicide, specifically in terms of in the Chinese academic context. So where to start, right? We have these three kind of key questions, where to start. We start from collecting data, right? So I mentioned that we do not have this official statistic. University, they may have collected, right? We don't know, but they never like talk about this like data they have or statistic they have, and then not going to be available to any researchers, right? So that we don't have data. So to collect data, what we have done is we know there's news reporting suicide, right? So we decided as a group to code each of those reporting, right? And then in the end, we identified 143 unique cases from the news report, and we coded in the news report. They talk about the gender in terms of binary men and women, and then year it occurred, and then they also talk about what caused one particular case, for example, the causes, and then what is the methods, means that the person, him or herself, and the academic rank and the institutional affiliation, right? And then we also have this like 130 happened in China, but there's also news report in China talk about Chinese commit or kill themselves outside of China, right? For example, in the US, last year there was one person because of the China initiative. The person from Northwestern University, professor, she killed herself just happened last year. So that's also news report about Chinese outside China. But for this paper, we focus on cases happened in China only. So 130. This is just give an overview of the data, like how we coded, right? So we have all those case numbers, year, and then gender, and then like more the variables that we from the newspaper reporting. So just talk about some patterns, data patterns from the data we coded. There's more men in that sense, right? So even though, like mentioned, in China, especially like 10, 20 years ago, one suicide pattern that is China different from other countries is that more females, right? But in this university settings, we find that more men committed or killed themselves than women. And mostly are younger graduate students and younger faculty members. And then almost all the cases came from the research intensive project 985, meaning that the top university in China, or 211, right? So most cases, almost all cases are from those top university, research university. And then majority are in science, engineering, and also from other like arts and social science and medical science. So that's just some patterns, right? But then just be mindful, right? Those cases are not representative at all, right? We just collect the reported cases, right? We do not know like how many cases out there in general. So in terms of statistical power, we can't use this to say much, right? In terms of inference or estimations. It's just an overview of the patterns from our own data. And then a few other patterns. One pattern is numbers have been increasing in terms of numbers, right? So in more recent, like for example, more recent 2020 to 2024, we have 38 cases, right? And the last decade, 2010 to 2019 is 52, right? And then before that, just every 10 years, right? And then the last like 4 or 5 years, we have almost a 10 years number. So this increasing number may suggest that over time, that more in numbers, right? Second pattern is the most common means is jumping from tall buildings. So that's the most common ways of people, academics and graduate students, how they kill themselves. Most common is jumping from height, from tall buildings. And there are also other reasons, hanging, drawing, and drug overdose. Third pattern is like many reasons, but those reasons were reported in the media, right? Like what kind of new reasons they talk. They talk about is family related stress and academic stress, personal academic meaning work related, right? And then they also talk about a combination of like family stress coming from family and also the work academic stress. And then so essentially they talk about the two main sources. One is really coming from family relationship, and second is just the working environment, the stress, right? And it's also gendered when we look into those patterns. For females, they're more family related when they report or how they talk about the cause of death. Female are often family related or relationship related, right? Relationship related. But for males, and more personal, right? So just talk about its mental health struggle, some other struggles. So that's gendered is from the news reporting. And also the pattern number 4 is changing narratives, right? We also look into over time how the media talk about those cases, right? So one pattern we showed is that before, in older time frame, they talk more about personal factors, just mental health issues, struggles, right? But more recent years, they pointed to other factors. For example, the lack of support from the institutions, right? And also the really work stress, work-related factors, and then the environment, kind of social, right? They stress more of those non-personal factors today. So those patterns suggesting that people start thinking about what caused the suicide, right? So before, just focus on mental health struggles, right? When people really identified or reporting mental health struggle as the leading cause, then there's no follow-up, right? And there's no meaning that it's just an individual private issue, not a public issue. So based on the analysis of the data patterns, right? So what we can do in terms of preventing suicide in Chinese academic setting, right? And we outline 4 steps. One is really focus on at the start is about perspective, right? And then we think about how to document and then research and then creating intervention strategies. So those are kind of a framework we are trying to go through. And then based on our data and more recent literature, we're trying to fill in like what our data like can inform a framework, right? What can we do or what to fill a more specific framework that is tailored to this settings, right? So this one thing, for example, changing perspective. We know that it's important to change perspective, right? So suicide means not just a personal issue, but public concerns. But how? So one argument we laid out is really the universities and government need to openly address when this happened, right? So they need to take responsibility to change that narrative, right? If they do not talk about it, then 2 things. One is people not going to think those as a public issue, public health concern. Second is that this lack of accountability, right? So if the university and the political leaders in the city level, national level, they do not openly address the rising number, or even just one case happened. If they remain silent, then there's not gonna change the public narrative, even media narrative. It's difficult to change. So that's one thing we highlight in terms of changing narrative. Second is really data collection, how we can do more to document those suicides, right? In China, this is kind of almost everywhere. This was more like sensitive things. And then there also research suggesting that, especially among younger population and in university setting, when a suicide happened, try not to talk about it, right? Or try because there's an evidence suggesting that if, we talk about suicide among younger people in university setting, we're gonna, lead to more, right? So the evidence talking about that. And there's also in China, in terms of suicide, only until 1987, the Chinese government start like really reporting or providing official statistic in general population, not the academic setting, right? Only until 1987, but then until today, there's no kind of official statistic kind of document the cases in the science community, even though from the news, we know it's happening every year, multiple cases every year, right? But then we still don't have official statistic. So it's very, very important to document suicide, right? Because the data and patterns are critical to developing strategies, to identify what are the causes, what are the common means, and how to prevent suicide, right? And second, number 3 is research, of course, right? So, and in Chinese settings, we talk about that from the media, the common factors they talk about is family relationship, right? Work-related stress, right? Or some other like, even though they're trying to think about it's not the individual, but still, when we think about family relationship, work-related stress, they still think about personal, right? Individual, right? But then the argument is that, yes, those are the key. If we think about social determinants of health, those could be the social determinants of suicide, right? But those social determinants also come from other upstream factors. Why there's so much stress among young graduate students in Chinese setting or faculty members, right? So the academic stress and family relationship coming from, for example, we list out several factors. One is political. It's political in terms of, for example, in science settings, it's political because China's ambition to lead the world in terms of science, right? China wanted to compete with US in terms of science production, research, and leading in technology and in academic research. And that, especially at the most research intensive university, that gives a lot of pressure on younger professors, even in terms of hiring. Evaluating their performance is more about how many papers you publish, right? Like what kind of journals. And they also have like award and scholarship. Like if you publish in science, you get how much money. Like it's still happening today in top research intensive university. If you publish a paper in science, you will get the award, like cash award, right? So, and that create those intensive competitive kind of like environment that is very stressful, right? And the other political legacy that people talk about in suicide is one-child policy, right? The legacy, even though the China is not like abandoning the one-child policy, but then most younger generation at my age, there's only one child in families. That means what? It means that one child, you have a lot of responsibility taking care of the families and right? Because if you just one single child, like high expectation from family, and also you have to take one child has to take care of like multiple like two families, right? If you get married, you have parents and then your parents-in-law, four, right? So that's one child policy give a lot of those younger academic students a lot of stress too, right? Now, institutional factors, a lot of like in Chinese university, a lot different from here is the hierarchy structure, right? So then if you are the dean, if you are like the leading researchers, you have more power than other younger, right? Younger faculty members and the graduate students, right? They control resources, right? So then that kind of structure also create a lot of power imbalance and the stress. And also in economic factors. Those top universities often come from big cities like Beijing, Shanghai, Guangzhou, and the housing price is like it's like here. So it's almost no hope, almost no hope, but even more so than Toronto, right? Beijing, Shanghai, right? So when young academics, graduate students, and that high housing price, right? So that lead to create a lot of stress. And then also thinking about over the last few decades, the change in China's urbanization. Many people, they were not born in urban China. They came from rural China. That's another reason that they need to have housing, right? Because it's not they were like born in Beijing or Shanghai. Many young students, young faculty members, they came from like rural China, right? And then the urbanization, and that also means they are far away from their families, right? So then support and the environment, the social environment is that when they go to a different place, a different city to work, the lack of social support, and that's also a factor that play in terms of the rising numbers of suicide, right? So meaning that when we have those data, we can identify the cause of course, right? Not just focusing on stress or risk or family relationship, but really think a step further, like what lead to those higher stress and then unequal relationship, right? What the cause of the cause. And then finally is really thinking about what can we do in terms of developing strategies, right? Even though we did not provide an overview what have been done, right? Probably very limited. Like we don't see, like we do not see and hear many actions, strategies being taken in university setting to prevent suicide, right? So a few things we highlighted is that really changing narrative is to mental health issues in China is still probably more as a stigma. People think about mental health as a stigma more so than in Canada, in other places, right? So it's very important to destigmatize the mental health issues, right? So people can openly talk about it, right? So when they need help, they can reach out, right? And then the university settings need to provide the mental health services, right? So probably like in China, because people are not still think mental health as a stigma, and people who in need help, they are less likely to reach out, right? And also there's less public response in terms of resources provided to people that in need, right? And then second point is really the means, right? We know that from the data, the jumping from highs is the most common, right? But then, like I said, the data is not representative, right? We don't know whether this is really the top, the highest number rate in terms of the means, right? Could be poison, right? People kill themselves at home. And the reason why from the news report, one reason we're thinking is that from jumping from high is the most common, is because of from the media data, because when people jump from high tall buildings, there's nothing we can do to, to not reporting it, right? But if happen at home, at a private space, then media probably, they don't know, they don't talk about, they don't reporting those cases, right? So that could be another reason. From that point, we can also think about that could be much more cases than reported, right? Because from the general population, with more official statistic, we know in China, poison is the most popular way of people kill themselves in China. But from academic setting, jumping from height, right? Jumping from height is could be a political statement from those who want to kill themselves, right? Because maybe they want it to be seen in terms of outcome, right? So that's something to think about. But from prevention perspective, at universities, there are a lot of that's what we need to do in terms of tall building, access to tall building, and monitor the people's mental health condition and their access to tall buildings or the kind of locations, places where those kind of things are more likely to happen, right? So then when we know that's the common means, then we need to find ways to limit access that need. And then the final point we highlighted is about a lot of cases talk about lack of support in terms of socially, but also institutionally, right? So people kill themselves, in graduate students, faculty members kill themselves because of lack of support. Support meaning social support. There's a lot of reasons by isolation, far from families, not to have many friends to talk things. So that's what social support. And institutional support is that because the institutions created this environment, right? And that also in Chinese setting, there's not much mental health services or attention toward, for example, young graduate students in the time of graduation, and the young faculty members in the time of getting like promotion and tenure, right? And that particular time, what kind of support the university need to develop and provide it to a population at higher risk, right? So in general, so those from our data patterns, we focus on the unique courses and means, and also prevention strategies. So the paper I shared is really a rough draft, right? So we still need to really think about how the data we had and then the patterns and how to think about inform a more specific public health framework, right? So if you have suggestions, please reach out and to me that help improve the paper. If you have like comments, really think about from the data how to turn into a more specific framework. So the key goal for us for the project is really try to really think about a very specific framework, right? Not just a general framework. We start from a general framework from the literature, but we hope to develop a specific framework targeting to academic, graduate students and faculty members in China setting, right? So that's in general what we are trying to achieve, to accomplish. Thank you.
Thank you very much. Got some time for questions.
So thank you for the presentation. I think it's such an important topic. And for me, one of the things that I found really interesting is media itself. And, you know, media tends to sensationalize certain topics, and suicide could be one of those topics that tends to be quite popular with media. And I wonder how your framework takes into account media as an influence. Because if you look at literature on celebrities, especially in East Asia, there's a lot of copycat suicides. And you know, some of the reasons that people say that there could be that is because it's also in the media itself. And I wonder if your framework kind of takes into account what sort of guidelines could be for media when they're reporting on this, especially comparing it to maybe other countries where they're also reporting on suicides. Like what's sort of the differences? Maybe they're not reporting on like the means, for example. Does that help or anything like that? The other item that I was thinking about in terms of data is I wonder if hospitals record suicide attempts. And that could be another way of capturing data in the process of suicide. That could be a next step maybe in the future to sort of look at suicide attempts and maybe factors related to that and add more to that data source. And then finally, just protective factors for suicide. I wonder if there could be an added element in the framework or in the paper talking about what can be seen as protective factors and to make.
Great questions. Yes, for the first one, thinking about like what kind of role the media can play in preventing, right? In literature, there are a lot of literature talking about the role of media, right? And then they also have the guidelines like media, how to report suicide. And there's, I think WHO, they have guidelines for media to like how to report. And there's also literature, like I mentioned, debating whether to report or not, right? In certain settings or among certain populations. There's some evidence suggesting for certain like younger people, maybe not to talk about it. That's also it's a huge debate in literature, right? But in terms of guidelines, it's very important, like you mentioned, like the role, like media, because for us, the framework in terms of media is like shaping perspective, right? Perspective meaning that how the media take responsibility or like responsible reporting, like what can be accounted as considered to be responsible reporting, right? What to talk about, what not to talk about, and how to talk about the case, right? So for us, we did not get into that in terms of like details, like what media should be doing, right? What we had is that we coded media data and highlighted how media talk about the courses, right? And then how the other thing is the limitation in terms of media reporting, right? So like if we only have cases from media reporting, then maybe this other cases happen, but like the media did not cover, right? So that's what we in terms of like in our framework setup, like what media in the role in our framework. But then that related to the data, right? You mentioned about attempts. Yes, probably will be, it's a good idea to really like if there's hospital data, that'd be great. But for researchers in Chinese settings, probably it will be difficult to have access to that kind of data. Yeah, but that's a great direction thinking about how to collect data, right? Like I said, like iceberg model is not, we're thinking about how to prevent the final outcome, suicide, but also before, right? Attempts is probably more important. Like more we can do to stop attempts than to stop the actual suicide, right? So if this public available data in terms of attempt, then that would be much more useful than the data we have to developing like prevention strategy and all that. And final questions is
around the protective factors. Yeah.
Right, protective factors, right? So that's in academic settings, still is about stress. It's about people relationship, because of the hierarchy, power imbalance, and also the timing, right? So it happened at a particular time when graduate students, when graduate students wanted to graduate, but then difficult for them to graduate at that. And then when graduate students in a bad relationship, like those bad relationship, and then a lot of model can be developed to identify what can be done to protect those at high risk vulnerable populations. And for faculty members it's also quite it's the timing in terms of a lot of people, those who kill themselves are from top university in the US. When they trained, got a PhD in the US, and then they went back to China, right? There's high expectation from the university, from even the political government, and also from themselves, right? But it's very difficult for them to fit in because of the power imbalance, right? You are an outsider, right? Relative to locally trained PhD students, right? And you are doing very different things. One is, for example, you mainly publish in English journals, but for locally trained PhD students and faculty members with local PhDs, they publish in Chinese and they have their own way of doing things. So there's a conflict in terms of what kind of things output should be evaluated and how their output performance should be evaluated. So those conflicts lead to stress and then at the particular tenure promotion time, right? So that a lot of cases we are recorded as young PhDs who got their PhD from outside of China and then went back to China to teach, and the expectations from family, from the university, and from, of course, themselves, and the conflict between local institutions and the different ways of people doing science learned outside that lead to higher risk of people killing themselves.
Oh, yeah, Emmanuel, go ahead.
Thank you so much for this excellent presentation. I think this is really a very important topic. Not only that, but I think it's even more important at this season that we find ourselves. But I think that the factors associated with suicide or even attempted suicide are actually complex and interrelated. It's very difficult, even for a given case of suicide, to attribute it to just one cause. That's what I mean. So in trying to gather evidence for the causes of suicide, we probably need to use different approaches to the investigation. For example, I would like to know your thoughts on looking at community approaches to the investigation. I would also like to know why you chose collecting information from the media over other approaches to investigation. This kind of very important issue, public health issue. The other point I wanted to make is that in terms of the causes, there are a wide range of causes. Okay, you mentioned many of them: emotional, cognitive causes, and even social factors. But some studies have also shown that there are anatomical factors in autopsy studies done on some of the suicide cases, they found that some of their brains have certain features, okay, that were peculiar to those who committed suicide. So we need to look at all of these things holistically to be able to come up with evidence-informed information for us to advise or inform policies and actual preventive measures that we need to undertake. I think it's going to be a wide range of recommendations. It's going to involve different sectors. Now we just see suicide as a mental health issue, or it applies only to the individual. We're not seeing it as a suicidal issue. It's grossly underreported, and I don't think we're doing anything significant suicide. There are many people who are dying that we think may be attributed to natural causes of death or some other apparent causes, but they're actually committing suicide. I give you the example of people who have chronic disease conditions associated with chronic pain. It is well known and documented that some of them actually, in the process, commit suicide. And often this is not documented. So I really want to hear your thoughts. Do you think this approach to this investigation needs to be more robust, or why are you focusing on media information? Given the overall objective of your study.
Certainly, yes, of course. Like you mentioned, two things. One is suicide came from multiple factors, including genetics, like the literature talking about people more likely to, some people more likely to kill themselves than other people simply because of genes, right? Genetic makeup. There's some research and evidence pointing or connecting genetic makeup and the likelihood. But what we wanted to highlight is the sociological forces, right? Social, political, cultural, all those forces. Of course, those are not the 100%, right? Those are the like real causes. We're just accounting that those factors could play roles in shaping the likelihood that someone more likely to commit or kill themselves than others, right? So that's what we have done. And then you mentioned that community participation kind of approach may be better. I agree. Yes, over data is not robust in terms of like just media newspaper data, and then they're not representative at all, right? The way we decided to do those kind of things is two things. One is that it's difficult to like collect any type of data about suicide, right? Here and also even more difficult in China, right? To get access or really find out the official statistic or interview people, right? So it's very difficult to do that. So there's lack of data, right? So that's another thing we think about that what need to be done is documentation or data collection or research in general, right? Including all types of research, right? We are presenting one like simple ways of documenting a newspaper report, but a lot can be done, right? And I'm new to this. It came to me, like I said, it's become personal. I have never done any suicide related project before, right? It came to me, we decided to do this documenting the news because of it become personal last year, right? Then we think about what things I can do. So that's, of course, I agree that community engaged participation, interview, or other methods probably will be even more appropriate than over just coding the news report to like really understand the cause, the patterns, and then the effects, right?
We are at time. I just want to check. We don't have any questions online. We don't really, we have quite a few hands. Maybe we can do like one last quick question.
So my question, it's not a question, I'm just interested to know when the political factors are indicating that not to report the suicidal cases and mental health problem is pretty much stigmatized in the community. So how feasible it is to develop the public health framework for preventing this suicidal attempts or suicides? It's because the hospital records and everything we need to take into the data collection and then the opinion of the doctors and everything, then the political factors clearly indicating not to report.
Very good question. I should change my title, not saying building a public health approach. I should say calling for a public health approach to suicide, because I can't do anything, right? Like you said, it's political because there's also like even in the news report, there's the top kind of health experts in China. They came out when the case happened, they came out to say not to report, not to talk about, right? So and these top health officials and experts, the one reason is it's like to like based on some evidence showing that when people talk about could lead to like more cases, right? So then, but for us, what we can do is instead of building a public health approach, calling for a public health approach, let's thinking about what a public health approach means in terms of like research, like meaning building data, right? Documenting, collecting data, like we are trying to highlight the importance, and then the importance of changing narratives, thinking about not to be stigmatized when people experience mental health issues, and encourage people to reach out for help when they need help, right? So those, and then like based on the data, right? For example, the most common means, then what can be done, right? So for example, limit access to the means, and then finally like try to evaluate, right? What kind of programs are in place in terms of raising awareness and whether they are effective, for example, in terms of limiting, right? So what I meant by a public health approach is more about like in that kind of like research side instead of like actual, like a public health response, right? So that we can't do much. We can only from a research perspective, but then from political action perspective, like there's a lot of like political barriers, especially in Chinese academic settings.
All right, well, thank you very much, Dr. Wu, and I'll give you a round of applause.
Like I said, the paper is really rough draft. Like I really hope, like if you have comments and suggestions, please send them to me. So like I hope to improve the paper a bit more, especially like thinking about publishing, getting it published. Thank you. Thank you for listening. Thank you for great questions.
Thank you.
Thanks.